continue to be aware of the position of your shoulder blades. So I want you to squeeze your shoulder blades down and back.
How often do you think about the position of your shoulders? Maybe not since the last time your mom told you to stand up straight. That is, unless you've injured your rotator cuff, those 4 small muscles that hold your shoulder bones in place. Then you might find yourself working with a physical therapist like Sue Johnson at Courage Kenny Rehabilitation Institute, part of Allina Health.
And then every 5 or 10 repetitions, as you bring your arms down, I want you to reset your shoulder blades.
She says regardless of whether you are rehabilitating a shoulder after an injury or strengthening a shoulder to prevent injury, there are 7 essential exercises to learn.
And they will emphasize the different parts of the rotator cuff depending upon which way the arm is moving.
The exercises start with setting yourself up in the right position.
Here in the clinic we work on teaching pulling the shoulder blades down and back, pulling the tips together like this. Sometimes it's easier for people to think of bringing the chest up and out.
Then the patient begins moving. The routine starts with a patient standing and swinging their arms forward in a controlled motion.
So I want you to hold this here, and I want you to lead with your thumbs straight forward, up to shoulder height, and back down.
It might seem simple, but it's easy to slip and forget your form.
And did you feel your shoulder pop up on that one? So we want to make sure you pull this down and back. The shoulder can either hike up or it can wing out. So we want to strengthen those muscles by holding it in its correct position, which is often hard for people to get the feel for and then to maintain that due to weakness. And then the next one will be out at a 45-degree angle, so reset your shoulder blades.
For the second exercise, the patient switches up the direction of the arm movement. Johnson suggests standing in front of a mirror to check your form. In the third exercise, the patient bends at the waist, looking sort of like a ski jumper.
And then you're going to bring your arms from straight down to back. Just a little past your side. A little bit more chest out. There you go.
Next up, the arms swing to the sides.
If it's a little tough on your back, why don't you bend your knees a little bit?
Always thinking about proper form.
And now reset these again. There you go. See how you lose it a little bit? You need to really be thinking about that.
Now the patient moves to a table for a countertop push-up.
And nice and slow and controlled. Keep an emphasis on your shoulder blades. Thumb up and raise your hand up.
The patient lies down for the final 2 strength-building movements. In one, he moves his hand from his stomach towards the ceiling.
Raise your arm about 45 degrees.
In the other,
and back down.
He positions his hand near the hip and raises it about 45 degrees.
We don't want to go any higher than that because we can pinch and cause pain in the shoulder.
The focus is on working up to a high number of repetitions, as many as 50, before adding light weights.
And then the weight we'll add is a ½ pound, and then a 1 pound, and then a 2 pound weight to isolate the rotator cuff muscles. Heavier weights than that, or our stereotypical weightlifting in a gym, is going to be making our bigger muscles work and not isolating our rotator cuff.
Isolating the rotator cuff is important, says Dr. Dan Buss of Sports and Orthopedic Specialists, whose patients often work with Johnson after surgery.
It's a whole series of little tiny muscles that have to fire in perfect timing for you to do something like hit a volleyball or hit a tennis serve or swim through the water. This repetitious sports are why we do such high rep activities in our physical therapy, because we want to work the little tiny muscles, which are endurance muscles.
Dr. Buss and Johnson say if you are injured, it's best to learn the exercises directly from a physical therapist. Anyone working on their rotator cuff should remember to work their reach within a comfortable range of motion.
We want people to get to fatigue with no pain. And we need fatigue to gain strength.
We want to try the non-operative approach to just about everything in shoulder and elbow. There's only a few things that require surgery right away. Most instability problems, most rotator cuff problems, most of your separations in the joint can really be pretty well managed in most people by an exercise program in some time.